This is the first video of several ones. The reason why I make these videos is because in the last 10 years I developed a new bridge design on implants. In my opinion, all these bridges we have nowadays screwed on implants are not really adequate for implants. They were adequate for proper teeth with the ligament and the shock absorbing. But the full zirconia bridges, the so-called silicon sound bridges, the ceramic fused to metal bridges, and the acrylic bridges are not really good. They have a lot of clinical problems. We have screw fractures, they are hard. If there's chipping, we can't repair. So this was my thought. Can we do that? Can we do that better? I think we have now a bridge. We call it SIEWERT bridge. That's really perfect. We have it the last generation. It's really the third generation, and the third generation is called the SIEWERT bridge. We have it in several patients in clinical use since 5 years, and there are no problems. So in these videos I show you first the clinical part and then the laboratory part. So you can go to the video where you're most interested in. What we do first to plan our treatment is to make some impressions. We can do it by a silicon impression, analog way, or even we can do it here by the scanner. Normally we do it by a scanner, but here on the dummy we have no contrast on the artificial gums and it's not working. So we take that impression out, hope that these teeth, the canines to be extracted, won't come out. Perfect. You see, we suppose that these teeth are loose, and so we extract the teeth and make an all-on-4 treatment. So 4 implants, 2 here in the anterior position and 2 tilted implants in the posterior. We have here the impression of the upper jaw and the impression of the lower jaw. We make models and we articulate them. So here I got that wise. We have a very hard putty that's easy to cut and it's quite precise. We take it in there. Oh, don't swallow. Like here. And here do our articulation, and we transfer that to our articulator. Oh God, it's out of focus. I'm so sorry about that. It's my first video. Now we can scan in the laboratory this maxilla. And we even can do a wax-up, a pre-treatment, to see if the treatment, what we want to realize, is really valuable. And then in this patient, I will show that to you, has a very large sinus. So let's take this maxilla out of the dummy. Okay, and here you see now both sinus and the nasal cavity, and it's really, really big. So it's very difficult to find the proper articulation. Okay, here you see the DYT from the dummy. It's an older one, you see here from 2012, and we needed these position points I mentioned before to match the model with the with the X-ray to have the reference. And if I go with my viewing window here, for example on the canine, and as you see, here's the canine. We see our nose hole we saw before. Here is the tangential cut, and you see how there's not so much, it's a very extreme all-on-4 case for this huge sinus. I will show you later on an X-ray how this from the outcome of our surgery. And if we go here to the other side, you see, we're scrolling. This is our proposal, our wax up for the teeth. Here is the canine, and here you see the other part, the second quadrant, and you see here in the second quadrant we have a little bit more space, and the sinus. Okay, we also could do an internal sinus lift, but I think the all-on-4 treatment is a good treatment. Here our cuts here are a wax up, and here's the bone, and you're like in a real case, here's the sinus coming through. Okay, big sinus, and here's the other sinus appearing on the left side. And this is exactly the same when we are planning the implants on this Blue Sky Bio software, matching DVT with an STL model. Okay. And there a surgical guide is really helpful. So in the past we needed to do a surgical guide with a RadioPark template in there. I have here from CCAT. We ordered these templates by CCAT. I have here this template. We had to fix this template in the mouse and make the DVT with this template. In order with this, I don't know if you can see it, we have here some pearls that are RadioPark. So these pearls you can see in the DVT, and then they can match the DVT with the model. That was 5 years ago. Today it's not necessary anymore. And this is a big advantage, because now if you already made a DVT and then we see, well, it's better to make a surgical guide, so we had to repeat the DVT. Now we just have the DVT from the initial treatment planning, we have our STL file of the model, and then we can match it. And there is one program I love very much. It's Blue Sky Bio. It's a software for planning the guides. You can position the implants in this program, and then you can export an STL file in order to print your surgical template. And normally these programs are complicated. This one is easy to use, and normally they are very expensive. This one is free. So I really recommend it to you. You can download it after registration and you can test it. And even I think you have 2 exports for a surgical blade free of charge. Just an interesting fact in the case you don't know it already. Okay, so this was the first part to this appointment of the patient to prepare the surgery, and now we go to our surgery room where we make our oral surgeries. And we put the surgical plate in the position. We have here a circular punch, okay, that fits perfectly in this first hole, and so we punch the gingiva here too, and we first make an impression. If we see that we don't have fixed gingiva there, so then we make a small flap, okay? If it's all fixed gingiva, we punch it directly. Here's my team. Blanca is my assistant today. We have no real sterile conditions. It's logical here on the dummy. And Viso is doing with the gumball details. Okay? We have here, and Viso will join me now. We have here a monitor. That's our camera. You see here, that's the mouse of the patient and live. And here in this monitor, we have the DYT of the patient. And here we can make X-rays if it's necessary. Okay, that's our equipment here, and it's usually we work quite nice. Okay, so we punch it. Show it how we are. We see it also in the monitor. Okay, here are in the hole, and now I make the punch. And here we have prepared our drilling sequence. Okay, so we put now these, for the pilot drill, these green tubes in there. Okay, it's tube and tube, and I will take the other one. We secure it, they are in place. Okay, yes, yeah, now they are perfectly in place. Okay, and I have my first drill, and with abundant water, with pumping movements, we make our, okay, right down to the stop. The other one, okay, yeah. And you see, for this inclination it's a little bit more difficult to find the correct insertion. Now we have it, and we are drilling. Okay. And you see we have here the result. We have the punched, you see it also on the monitor, the punched one. We have here the extraction holes and the posterior, the two posterior ones. This one is a little bit more to mesial because the sinus is bigger on this side. So we will see that on the final X-ray. Easier to make the final drill without template, okay, so we can control it better. So we work since a lot of years with this implants. It's a company in Madrid. It's MPI. I like it very much. They have 4 kinds of implants, 2 different connections. We have the external hex, a Panoramic type. We really don't use, but I will use it for these 2 implants. And we have an internal connection, an Astra type connection. If you want to measure something in the mouse, we use this instrument. Okay, to 15, we have 15 here. So let's control it. You see, this is really 15 millimeters. Don't use this one. This is awful. This is so difficult. You really can't clean it very nice. So and then we have two positions. It's absolutely annoying. So here you have the inner dimension. On this side you have the outer dimension. It may move, so you have to fix it. It's not useful. If you have it, just throw it away and use this one. Okay? So we throw that away. Okay, now let's go into the final insertion. So we use the final drill of the implants from MPI. This is this one. And freehand we go in and let us, it's just, I don't push, I just push here so that my previous drilling is guiding me and I get it in. Okay, so we have this one. Here I go in, it's guiding me, I push it in a little bit. I go it to the 15, we have here our marks. And here the same. Here this is our 15 millimeter mark. Okay, so we go in. We drill always very reduced revolutions, about 200, okay, 400, and now we have it in 18 revolutions per minute to screw it in. Implant finds the way. Okay, we will check that. Okay. Yeah. Let's see. Yeah, that looks nice. Now we screw. Here we are. Okay. The next one. Same procedure. Put the implant in. And let the implant find its way. Okay, here we are. Okay, we could test the primary stability, it's quite good. The next step is to add the universal multi-unit abutments to the implant. In order to compensate the angulation of the implant and the peri-implant soft tissue thickness, we have several different types. We have the 0 degree, in different heights. We have the 17 degree, which one we used in this case for the two anterior implants with a thickness of 2 millimeters, and the 30 degree we used in the posterior region with an implant height of 3 and 4 millimeters. The universal multi-unit abutments are available for nearly every implant system on the market. The carefully selected and screwed on multi-unit abutments represent the baseline of the SIEWERT bridge. Okay, so we see where we have more tissue height. Here we have a little bit more, so we put here the 4.5 millimeter tissue height in there. Okay. And we search our perfect inclination. You see, with the internal hex, this positioning is a little bit easier. And additionally, we have the platform switching. Here, I think that's perfect. And so we screw it. Okay. Nice. And then we open the other one. Okay. Here is the abutment, and this one is 3.5 millimeters. Okay, you see our abutment and the screw. Here we have a little bit more, that's for the sinus, more inclination. So let's see if we find the implant. Okay, here is it. And now the screwdriver. Okay, and you see we perfectly compensated the angulation of the implant. Okay, so that's necessary. We want to have this direction in the occlusion, and we don't want to have it from vestibular. So this will be our chimney for the fixation screw, and this must be inside the occlusion. Okay, now this is our baseline for the SIEWERT bridge. Okay, you can put every kind of implant in there. It doesn't matter. It may be whatever the company is named. You can use your implants. Then you put the multi-layer universal attachment on it. A lot of manufacturers have them, and some companies, or implant companies also. And now we have a really good situation. And now, because the implants or the abutments are parallel, it's very easy for us to do the impression. Do our impression. Okay, you may help me to open this. We have here sterile impression posts. Open this, open. We put them on. Okay. Absolutely easy now. All the work is done. We can make a precise impression because it gets out, because they are parallel. Okay. Here and here. Next one. Okay. They are in place. We check that. Yes. Okay. 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 Now we make a ferrulization. We have this one. It's easy to bend. It says 1.2 millimeters thick. It's hard but not elastic. And so this helps us. We already prepare the piece and we see if we can make here, we adapt it to our situation. Okay. And then a very useful material, I really can recommend it to you. It's you can use it in the patient's mouth. It's Delta Splint. We buy it here from Cus Dental in Spain. And here we have this black pocket, and here it's our material, and we need now the light, the ultralight from the second, and it's very, very easy to put it on. Okay. Okay. During one day, he's not in contact with people, and it's no problem that there is no bridge in his mouth. And tomorrow we screw in a clean, a perfect bridge made by PMMA, which will be already our fundament for the SIEWERT bridge. Okay, this I will explain in further videos. Perfect, so we have our impression tray. Okay, I mark the positions of the implants. Okay. So it's hard, it's good in position. You see here we have this the posts. So now we get them out. Okay. Everything is parallel. It's really easy and precise, because the problem is that the abutment, the impression abutment, is inside the implant, and to get it out, the impression post has to make a movement inside the silicone, and that's costs precision. Okay, and just the last one. Okay, and as you see now it gets easily out, and we have a good impression. So the last step really with the patient is that we put here the cups on. Okay, I have here one cup, the small screw. and that's it. And so we repeat this for the next ones. Our next video goes to the laboratory part. That's really the most important part for the SIEWERT bridge. But I hope I could give you some valuable information on how we are doing the things here in Clínica Somos Aguas, and thanks for watching. See you next video. Goodbye.